There is a breakthrough in the latest clinical trials by Kenya Medical Research Institute that promises to avail 2 tuberculosis vaccines for both adults and children that will shorten the treatment period from 6 to 4 months.
Currently, the treatment of tuberculosis is 6 months, and previously it was about 18 months.
The new regime released locally by KEMRI is set to treat the disease responsible for at least 6% of all deaths in the country. The team is working on phase 3 vaccines trial for infants in Nairobi and Siaya counties,
where we enrolled 851 newborns at birth here in Nairobi and about 812 in Siaya. And we vaccinated them in 2 groups.
At the same time, researchers in KEMRI, together with partners, are working on the best ways to diagnose TB in children using a system that will be able to confirm the presence of TB in small amounts of blood, as well as accessing the presence of TB cell-free DNA in urine and blood. Soon, the team will also develop a software that is able to distinguish between a TB cough and any other cough.
Again, you'd install an app on a Samsung phone. A patient would walk into a doctor's clinic, the patient would cough, and the doctor would be able to tell whether that is TB. With
this year's theme being Yes, We Can End TB, the Ministry of Health has called for early detection to enable successful treatment of the disease in a commemoration of World TB Day at the Huruma Grounds in Eldoret in Uasin Gishu County. The event was presided over by the Prime Cabinet Secretary Musalia Mudavadi and Health Cabinet Secretary Susan Nakhumicha, who promised to increase stipends for community health volunteers, adding that the government is working towards lowering the cost of NHIF.
Tutawaeleza vile namna kulipa NHIF tutakuwa tumepunguza kutoka shilingi 500 hadi shilingi 300.
From April, the government is making the necessary arrangements through the budgetary process so that these workers can also draw a stipend.
Recent estimates by the Ministry of Health show that 133,000 people have developed TB, among them 16,000 children.
Sahi sasa nimepimwa iko sawa, so mwito ingetoa kwa wale wagonjwa wa TB, fuatilia kabisa vizuri sana dawa yako vizuri, usiache dawa.
In 2022, the ministry recorded 90,841 TB cases compared to 77,854 cases in 2021. With the Center for Disease Control Kenya reporting that TB-HIV co-infection dropped to 23% from a 50% high recorded a decade ago. Harriet Chimea, K24 TV.